hospice patient and provider should know the rights of the patient. In episode 4 of our Patient Rights series, we're talking about the right to start and stop hospice care. You're listening to Heartbeat from the Heart of Hospice. I'm Helen Bauer here with Jerry Fenter.
Whether you're a family caregiver or an end-of-life professional, we're here to enhance your hospice experience by connecting you with information you can use about end-of-life care. Because we know how busy life can get, Heartbeat is designed to give you helpful information in a bite-sized format.
I'm tempted to say, this is the most important patient right.
Yeah, they're all kind of important.
I know. I think I've said that on every one of them. So we've talked about the right to make a complaint, which is probably the most important one.
Right.
The right to choose your own physician, right? And today we're talking about the right to stop and start hospice care.
Okay, so this is really a myth that many people have about hospice, is that once you're on hospice, you can't get off of hospice. And that is not true, because the patient or the family caregiver, the responsible party, has the right to say when hospice is started, and they have to sign a consent form that says they're willing to start hospice for the patient.
Right.
And they can also stop, which means they revocate hospice.
Right. So you can't just arbitrarily put yourself on hospice. It doesn't work that way. A physician has to make the decision about whether a patient has a 6-month life expectancy. It's what we call a terminal prognosis, 6 months or less, which is, again, that's regulatory, right? And not so much the patient's worry. That's responsibility of the physician. But without that certification of terminal illness, as we call it, a determination that there's only a 6-month life expectancy, there can't be a start of hospice.
Right. But patients can choose to delay the start of hospice. Just because the physician says that they have a terminal illness or a life expectancy of 6 months or less does not mean that the patient wants to start hospice. They can choose to delay the start.
So if a physician recommends it, a patient can still say no.
Right.
They can choose not to have hospice at all.
Yes, they can.
But why? There are a
Okay.
lot of different reasons.
All right, so let's talk about this. Patients can choose not to start hospice because it feels like it's giving up.
Feels like it's a loss of hope to them.
They want to do things in their life. They still have this desire to do things. And so for them, it feels like it's giving up. They also think that if they start hospice, that somehow it's going to make their death happen faster.
Right. That it somehow precipitates out the death.
Right. Just because you talk about it doesn't mean it's going to happen.
Exactly. I think for some people it feels like a loss of autonomy, a loss of control. And this goes back to decision-making and rights. What do you have the right to decide for yourself as a hospice patient?
Sure. Sometimes the patient or the family wants to wait for test results. Maybe there's been a biopsy,
Right.
and so they want to wait, or maybe they want further surgery to be done.
Right. They might be wanting to pass a milestone, an
Okay.
anniversary, a holiday. A lot of people will say, November, December, if there has been a referral for hospice, a recommendation by their healthcare provider for hospice, they'll say not till after the start of the new year. They want to get through special holiday times, certain times, special times that they spend with their families, birthdays, anniversaries, things like that.
Sure. And sometimes it's also because they have a misunderstanding of what hospice really can do for them.
Right.
And there's those myths that are out there
Right.
that scare people.
Exactly. Like you can't do what you want to do if you're on hospice.
Right, which is why we're doing this series on patient rights, is because we want you to know that you have a choice. Not only choosing to start or stop hospice, but you also have a choice in many other things in regard to your care.
Right. And how this care looks for you. So here's one last reason people might refuse hospice or delay starting hospice. And it makes me sad, but it's a reality. They might have had a bad experience previously with hospice care.
That's true. And let's be honest, it does happen.
It does happen. Hospice teams are human. I like to think that most of our mistakes are just made from carelessness, that there's not true evil, right?
Right.
People that are trying to do bad things. But the fact is, yes, we are human, right? We work in a flawed system. We know that. Everybody in the United States knows that. I think most agencies are trying to do the best they can, but mistakes do happen. But I think that seeing someone else's bad experience, if you had a loved one or a friend, family member who was on hospice and the experience was not good, the care wasn't good, then you look at that and you think, maybe I don't want that for myself or for my spouse, my sibling.
Right, exactly.
Yeah.
So here's what we will tell you, though. We know that you have the right to delay hospice or to choose not to use hospice at all.
Right.
Obviously, from our perspective, as people who work in hospice and provide care in hospice, we hate to see people delay hospice because there's so much that hospice can offer to the patient, the family, the entire caregiving system. There's so much that we have to offer that we really hate to see the delay or the refusal of hospice.
Sure.
Because there's so much that we can offer. But we also understand that you have a right to choose.
Yes.
And we respect that right.
But what is one of the things, actually this goes back to the inception of the podcast to begin with. What did we say that we wanted to eradicate things that we had heard people say, patients and families?
Right.
The one thing they said to us was, we wish we had known about this sooner.
Right. We wish we had known about hospice sooner.
Yes.
So this is one of the reasons why we're doing this series too, is because we want to clear up some misunderstandings about what a patient can and can't do. And we want to give the patients the empowerment to know this is what you have the ability to do. These are your rights.
We wanted to take a moment to remind you that the mission of the Heart of Hospice is to be an advocate for quality end-of-life care. One way we do that is by providing education and consulting for hospice and palliative care professionals. The leadership of the Heart of Hospice has over 20 years of combined hospice experience. We can provide training for your interdisciplinary team through webinars and virtual events on topics such as self-care and grief management for professionals, diversity, competency, and healthy boundaries, or a topic of your choice. If you need a speaker for a leadership or community event, please contact us at host@theheartofhospice.com. Now back to today's episode. Okay, so let's talk about coming off of hospice. Stopping hospice, you already said it's called a revocation. It's to revoke, means to take yourself off of hospice care.
Right. And there's many reasons why a patient might revoke hospice. So this is one thing that we probably need to clear up as well, because we hear people working in hospice who say this all the time. Well, we revocated the patient.
Oh, Jerry, why do you say that to me? You know, it's like a nail right in my head when you do that.
Because the truth of the matter is, we in hospice do not revocate a patient.
No.
The patient or the family, the responsible party, are the ones who choose the revocation, not hospice.
That right lies with the patient or decision maker. Absolutely, legally, hands down, period.
Okay, so what are some of the reasons why a patient might revocate from hospice?
Well, it may be that they want to pursue treatment. Continue treatment that they had stopped before. Maybe they feel stronger, or maybe they feel like it's not a good vibe and they want to continue treatment. Maybe there's a new drug or therapy that they've heard about. Maybe there's a new facility, a hospital system that's doing something groundbreaking and they want to be part of it.
Sure. And maybe it's just because they don't feel like hospice is a good fit for them right now.
True. That maybe the care wasn't what they expected. And that's a disappointment from our side of things.
It is.
Because if the care is not what the patient and the family expected, then somehow along the way we did not communicate who and what we really are.
That's exactly right. So we hope that doesn't happen, but sometimes it does. And we are realistic enough to know that when it does, it might be that the patient decides to revocate.
Yes, that's the price we pay for that kind of thing. Maybe the care is poor. It happens, right? We talked about this. People make mistakes. Communication is poor. People's personalities don't jive. The cultures don't fit well. And they may just decide that this care is substandard.
Right. And it could be that the patient or the family don't like the hospice philosophy, because hospice is a different philosophy than just general healthcare.
Yes.
So they may not like the philosophy that you have a team. Maybe they just want one person to provide their care instead of the whole team.
Right.
Or maybe they just don't like the philosophy that they can't get aggressive treatment when they need it or want it.
Right. So there are a lot of different reasons a patient can choose to delay or choose not to have hospice, and several different reasons they can stop hospice when they want to on their own timeline. But the fact of the matter is that right lies with the patient or the responsible party. It's an important right for a hospice patient.
Here's one thing that hospice providers should know too. There's no such thing as an automatic revocation.
Oh.
Again, that goes back to, we're going to revocate the patient. No, the hospice agency does not revocate the patient.
Did we say that enough? Should we say it one more time?
We've said it enough, I think. A revocation doesn't happen just because the patient goes to the hospital.
Right.
There's a lot of variables that are involved in that. And still, it has to be that the responsible party chooses to revocate the patient.
Right. And so the automatic revocation, that is not a thing. Managing how a revocation is documented and the discussion that happens, all of that is the responsibility of the hospice agency, right? That all has to go into the medical record. But this is what I will say. The patient or the responsible party, it is so important that they communicate to their hospice team, not just to be advocates for themselves and to flex these rights so they know that they're getting good quality care, but just out of courtesy. These care teams are running a business. They're providing care for numerous patients. And when you're a caregiver for a seriously ill person, you have one patient. How that agency handles their internal communications and how they care for other patients, that cannot be your problem. It should not be. There should not be any expectation on the part of the interdisciplinary team that you're concerned about the inner workings or you're short-staffed or any of that. No, a patient or caregiver, they can't care about that, and they shouldn't.
They shouldn't. No, that's not their concern at all.
So if you choose to go to the hospital for whatever reason, communicate to your agency that you're doing this, that you want to come off of hospice. Make yourself available to sign the revocation form. Make sure that you're communicating so that you don't have staff coming back out to the house the next day, wasting time and mileage and energy on making a visit that's not going to be made.
So just know that you have the right to start and stop hospice.
Thanks for listening to Heartbeat from the Heart of Hospice. I'm Helen Bauer here with Jerry Finter. Because we know your hospice journey is 24/7, you can always find us at theheartofhospice.com. Subscribe to the podcast wherever you're listening, and please take a minute to leave a rating or review on Apple Podcasts.
To connect with us, you can send us an email to host@theheartofhospice.com. And you can also find us on all the social media platforms. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.